All right, welcome back to SUPERSTAT, the podcast where we explore the crossroads between laboratory medicine, healthcare delivery, and real world impact on patients and our healthcare systems.
Yeah, so today we're going to be unpacking a sobering story from federal courts that highlights how laboratory testing, when misused, can become a vehicle for fraud. Dun 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 dun. We'll dive into the details of this recent $4 million million Medicare fraud conviction and look at other high-profile lab fraud cases.
I feel like even though this happened back in February of 2025, it's like no one was talking about it. I didn't even really hear too much about it, but we're going to break it down today. And also, we'll discuss how types of specialty testing really work in chem labs and why proper methods really matter.
Yep, let's get into it.
That's right. Dun, 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 dun. The names and labs have been changed for the protection of.
We didn't change it.
This past year, a federal jury in Detroit convicted Sheriff Khalif, the owner of Spectra Clinical Labs in Gardner, California, for his role in Medicare fraud schemes that caused more than $4 million in improper reimbursement.
All right, so here's how the scheme worked. Khalil and his co-conspirators targeted patients receiving pain management care and submitted claims to Medicare for the most liberally reimbursed urine drug testing panels. These were neither medically necessary nor ordered by the patient's physician.
So, where is my Wendy Williams button? Allegedly. Allegedly. So, allegedly, to generate revenue, Khalil paid marketers to share a share of the Medicare reimbursements to secure orders for expensive drug tests. To conceal these kickbacks, allegedly, he routed the payments through companies he secretly controlled. Allegedly.
Allegedly. What's crazy though is that marketers then trained allegedly at the doctor's staff at the doctor's offices to send orders for these tests even when the doctors didn't authorize them. So like they came in and actually trained like the MAs and the nurses and all that stuff. And the lab had no documentation of clinical necessity for the testing. So lab was kind of culpable too, right? They're sending this stuff out. And this is where it kind of scares me because we're all familiar with the sales house calls that they make. Vendors will make to physician groups and especially like clinics.
I know it's unrelated to this, but as a quality person, I heard the words no documentation in lab. I was like, that's not supposed to be in a sentence. If you don't document it, it doesn't happen. Okay, anyways. Okay, I gotta calm down. Getting worked up about fraud and not documenting stuff. But okay, so Mark Weiss on LinkedIn, he kind of summarizes it best by saying, just basics of kickbacks are still illegal. Seems like common sense, but we have to remind people of this. Billing for unnecessary tests is a fast track way to be like go through prosecution. So if you're doing a test, then bill for it. If you're not, then don't bill for it. Paper trails sink ships, kind of important. There. And your staff can get you in trouble because they are going to do the right thing as laboratory professionals. And Medicare and Medicaid, they are always watching. You think people aren't, but they are.
Yeah, so if we back this up a bit too, I mean, this is a multi-million-dollar drain on our taxpayer funds. None of these tests, actually all of these tests performed, should have never been performed or ordered. This guy was found guilty of conspiracy to commit healthcare fraud, wire fraud, and conspiracy to pay and solicit kickbacks. So now he potentially faces up to 20 years in prison on the fraud count and an additional 5 years for the kickback conspiracy.
Federal enforcement against similar schemes have been ongoing even through 2025 and 2024. There's a guy in Georgia, Manal Patel. He ran an even larger scheme involving Medicare claims for genetic testing that was unnecessary. Over several years, he submitted more than $463 million in fraudulent claims. of which Medicare paid over 187 million. So patients were contacted. What's interesting about this case is that they were contacted through telemarketing, told genetic testing was covered, and tests were ordered without true medical indication. He was convicted on multiple counts, including the wire fraud and the conspiracy to pay kickbacks, like our other friend was as well. But like, there's weird that the telemedicine was part of it, you know?
Yeah, we have to be very vigilant about fraud and scams. It's very common. I'm in Texas, and we had a case here where there was 359 million, so millions of dollars again in unnecessary genetic tests through hiding kickbacks and sham contracts.
Yeah, and I'm in Florida too, so I'm sure stuff like this is going on in all of our states actually. But there's a huge difference between first line confirmatory screening and profiles. So if you're a not a laboratory professional or a healthcare professional, you hear all that and you're like, oh my gosh, well, what does all that mean? It can get confusing, but there are differences that you kind of have to pay attention to and advocate for as a patient.
Yeah, and from the clinical chemistry, like I'm a clinical chemist side of things, when we look at drug testing, and I do this even for med students, they come through and we talk to them about this. You know, the first line for medical drug testing, which is very different than SAMHSA type, like employee and workforce drug screening. Those are legal drug screens. Medical drug screening is presumptive, with the exception of alcohol for reasons, which is zero order kinetics. But you know, we have to be clear that immunoassays carry risks of false positives and negatives due to cross-reactivity and limited specificity, which keeps them cheap, right? But the money is in the confirmatory testing. It's in the, you know, what we would call the gold standard of liquid chromatography, mass spec, lab-developed testing, where you can really charge a ridiculous amount of money. Also, that adulterant testing is done. So like if someone put Visine in it or like a Beecher drug test product, like they could pick that up. Medical arenas rely on confirmatory testing. But that is, again, confirmatory, right? So if something doesn't line up in your screen, then that would be clinically indicative of needing that. It's also, you know, highly specific. We can quantitate. And so it's just the better test. But you know, people don't necessarily understand that when you're selling it to them, right? They don't know what the algorithm should be all the time. There's even some I think there's some drug DNA testing now that's available. So like it just gets really specialized, and there might be a forensic or even a toxicology use case for that, but it is typically not routine medical screenings.
I think it is so complicated as to what disease is indicative. What is simply there to be noted, but it doesn't guarantee that you actually have the disease. So just because the markers are there, or the genes are there, are they actually on? So there's a lot more than just getting a test result, looking at it. There's an interpretation, there's thought behind, okay, what's actually happening here? And unnecessary testing, especially without that clinical indication that I kind of touched on a little bit, can lead to patient confusion, can lead to stress, because you might be stressing about something that clinically is not occurring, and it can lead to harm when results are misinterpreted. It's been a while, but I know with Huntington's disease, with the life expectancy, that stigma that's there, you do see potentially suicide risk from those patients when they get these test results thinking that, oh, this is the end of my life, but this is just a result that's giving me an answer to kind of interpret how I proceed forward in life.
Yeah, and you think about something that we have been fighting for a long time. It kind of got better during COVID, but the erosion of trust in valuable diagnostic tools. You know, there's a time and a place for these things, and trust is already so hard when it comes to the medical arena. And laboratory tests are meant to support patient health, not become a vehicle for illicit gains, which is what is happening in these cases.
Yeah, and on the technical side, understanding proper testing technologies, whether it be immunoassays for screens or mass spec for confirmation, reinforcing why rigorous methodologies are essential in clinical practice and algorithmic use for test utilization is there. This whole thing makes me wonder, like, where the medical director was and why these clinics did not have availability to reach out for consult. I think there's deeper dives that we could talk about. But also that this kind of snuck under the rug for us. Like, I wasn't aware this was a thing. Like, this would have been an opportunity for laboratory professionals to kind of speak out and say, like, this is who we really are, and this is where, to your point, Steph, about the trust, right? And it feels like we had a missed opportunity there.
Mhm.
Yeah, exactly. We can be that advocating voice that they're like, oh yeah, the laboratory professionals did bring that to light, or I understand that a little better because of medical laboratory scientist Jay, or that was there to kind of explain that result. But as you can all tell, we could talk about this for hours, and we often do talk for hours throughout the day. But we're going to have to kind of call it a day. That the phone is ringing. They're calling for that stat troponin in the ER. So as always, thanks for listening to SuperStat. Make sure if you like us, subscribe, leave us a review. Let us know what you guys think. Join us next time as we continue to explore where the science, ethics, and real world practice of laboratory medicine intersect. Until next time.